To it for the pesky pain after surgery has some people avoiding going under the knife for cosmetic procedures, and some of the drugs used to manage the pain produce some unusual behavior, like maybe forgetting major life events.
You're my wife?
Yeah.
Holy sh**.
But there's a relatively new drug that will keep patients numbed up days after the procedure. Baton Rouge-based plastic surgeon Dr. Anthony Stevens joins us today to talk about something he calls a game changer for plastic surgery. So what is this?
So, you know, in my practice, we've been using this drug called Exparel for about a year now. And if we're talking about abdominal surgeries, you know, where you have pain along the abdominal wall, and patients simply can't take deep breaths, they can't walk after some of these surgeries. So if we can inject a drug, and this is a local anesthetic drug, kind of like you've been in the emergency room and you've had a cut and they've numbed you up with lidocaine. Well, this is a similar drug in a sense that it's the same injectable kind of thing, but it can last up to 96 hours. So patients now can get up, actually walk, move around, and alleviate some of those problems like pneumonia and probably DVTs, which are blood clots in the leg that can go to the lungs. So I think it's a game changer in our practice as far as getting these patients up, moving them, decreasing the potential complications, and decreasing their pain, so they're much more comfortable even after, you know, major abdominal surgery.
And it's fairly simple to give to
Well,
patients.
it is. I think it's very simple to give. It's as simple as drawing the drug up and injecting it into the abdominal wall during the surgical procedure. It's a local anesthetic, if you will. And so you've seen here on the pictures that we have, it's actually injecting it into the fascia, which is the covering of the muscles, if we're suturing the abdominal wall muscles back together. And so it effectively numbs that area, allowing pain-free, if you will, or decreased amount of narcotics patients will have to take for up to 96 hours. So it's a major breakthrough, I think, in pain control when it comes to abdominoplasty. And it's even being used in, say, breast augmentation, that we're using it now, too. And so I think that with the advent of this new drug, we're going to see less major complications in our surgeries, and those studies are ongoing now.
Okay, and does it work for everyone the same, or is it different?
Well, I think everyone is a little different in how their effects of it, but we're seeing across the board over the last year in our patient population a significant decrease in post-operative pain, and we will have these studies ongoing, and I bet you that we see decreased amounts of pneumonia and blood clots going to the lungs. And so those type of things are huge when you talk about decreasing risk.
So it gets patients up and moving.
Absolutely.
Okay. Dr. Anthony Stevens, thank you so much. You're watching WBRZ News 2 at 4. We'll be right back.